Hey everyone, I'm Danny Shuda, and today I'm going to be talking to you about something of major importance, the U.S. Department of Health and Human Services. This federal agency is also often referred to as the U.S. Health Department, or by the acronym HHS. The function of the HHS is laid out pretty explicitly through their mission statement. It is the mission of the U.S. Department of Health and Human Services to enhance and protect the health and well-being of all Americans. They fulfill that mission by providing effective health and human services and by fostering sound, sustained advances in medicine, public health, and social services. Now, while this seems like an extremely daunting task that Tom Cruise himself wouldn't even be up for, the HHS accepts this responsibility daily and is subsequently involved in nearly every aspect of healthcare as we know it. In order to tackle the enormous task that the HHS has in front of it, the U.S. Department of Health and Human Services delegates responsibilities to its 11 operating divisions. These operating divisions fall into two categories, either the U.S. Public Health Services or the Human Service Agencies. The U.S. Public Health Services is responsible for matters concerning public health. Some of these agencies include the Agency for Healthcare Research and Quality, Agency for Toxic Substance and Disease Registry, Center for Disease Control and Prevention, Food and Drug Administration, the Health Resources and Services Administration, Indian Health Services, National Institutes of Health, and Substance Abuse and Mental Health Services Administration. While the Human Services agencies are responsible for providing fundamental human services to all Americans. Some of these include the Administration for Children and Families, the Administration for Community Living, and Centers for Medicare and Medicaid Services. Altogether, these operating divisions take over all the responsibilities of the HHS. By this point, you all have probably gathered that the HHS is pretty important. But just how important is it? Well, for the 2017 fiscal year, the government budgeted to spend more money on healthcare than on the Department of Defense and welfare spending combined. The HHS received a whopping $1.45 trillion, with the government's $3.65 trillion budget to fund over 100 programs, which were all aimed to help meet the health and essential human service needs of Americans. Just let that sink in for a minute. $1.145 trillion? What would you do with that money? Utilizing these funds, the HHS was able to provide healthcare coverage to over 100 million Americans, seek out ways to end population disparities in healthcare, contribute billions and billions of dollars to medical research, provide mental and physical wellness programs to the public, advocate for reforms to the current medical system, and improve the overall safety and quality control of healthcare, medications, and food through various regulations. When more closely examining the breakdown of HHS spending, the HHS is spending the majority of their budget providing healthcare coverage for the people least able to help themselves. 52% and 34% of all funding was spent on Medicare and Medicaid respectively. But even after all this, you still might be thinking, so what? How could this possibly affect me as a physical therapist? Over 1/3 of the population has healthcare insurance coverage through Medicare and or Medicaid. And depending on what setting you work in, this proportion of patient coverage could be even higher. These facts become increasingly important when considering the HHS and Medicare play an enormous role in healthcare reforms. For example, Medicare and the healthcare system as a whole are transitioning away from a fee-for-service payment model and progressing more towards an outcome or value-based payment model. What this essentially means is that the healthcare providers will no longer be compensated based upon the quantity of services and treatments that they provide. Instead, billing will be tested based upon the quality of care provided to the patient, which is evaluated by comparing measured patient outcomes to performance standards. The major aim of this reform is to reduce the overall cost of healthcare through the reduction of unnecessary treatments and services. Fortunately, physical therapists have long been committed to providing evidence-based treatments for their patients. However, with Medicare and Medicaid patients making up such a large proportion of physical therapy patients, PTs must be adamant to continue implementing evidence-based practices to attain satisfactory patient outcomes. This must be done so that they will not be seen as an unnecessary healthcare service. If PTs are able to continue to produce favorable, quantifiable results with their patients, it could definitely lead to physical therapy becoming a more preferred treatment option rather than some other form of defensive medicine. Another major HHS focus that could impact physical therapists is the commitment to lowering the usage of opioids. The opioid epidemic has emerged as the deadliest drug epidemic in American history, claiming 91 lives each day. The HHS is making major investments to reduce opioid use by promoting alternative methods for pain management, such as physical therapy. The usage of physical therapy in chronic pain treatment is not only safer, but also can be seen as more effective than opioids in long-term pain management. This is primarily due to addressing the underlying causes of pain, not just the surface symptoms. Physical therapists could play a pivotal role in this initiative set out by the HHS to advocate for more responsible pain management strategies. Physical therapists should not hesitate to get involved in this HHS program, others like it, or simply research more about the HHS and its involvement in healthcare. For more information, please see the following links or visit hhs.gov and explore various resources available on their website.